Hello, my name is Kaylee and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 231. Do you have time to give me a report?
Sure. Let's see here. So in room 231, we have Shanae O'Connor. She's a 34-year-old female. She does have an allergy to Bactrim. She gets a mild rash when she takes it. She has a full code, and her primary is Dr. Engelbert. She is married with an 8-year-old son, and her husband's very involved in her care. She came into the ER this morning around 5:30 with an unexplained fever, some chills, generalized malaise. She has an end-stage renal disease and is a type 1 diabetic. That has been well controlled. She's been type 1 diabetic diagnosed since she was like 8 years old. So the past few days her glucose readings have been elevated. She has had a decreased appetite and minimal urine output for about the last month. She's been on dialysis for the renal disease for about a year. She goes 3 times a week. She was put on the transplant list 6 months ago. She does have some proliferative retinopathy, diabetic neuropathy, and hypertensive nephrosclerosis. She does have some diminished sensation in her lower extremities, but she is fully ambulatory with full range of motion. She is alert and oriented times 4, but she does have some generalized weakness. At 6:45, she complained of generalized pain and discomfort and was at a 4 out of 10 on the 0 to 10 pain scale. We gave her 650 milligrams of acetaminophen at 7:15, and she appears to be somewhat more comfortable. Her labs are currently pending. We do have cultures out for a suspected urinary tract infection. She's slightly diaphoretic. At 6:45, her temp was 100.9. Her heart rate was 104. She was good with O2 on room air. Her stats were at 96, and her blood pressure was 136/85. And then at 7:30, we took her vitals again, and her temp had went to 101.1. Her heart rate was 95. Room air still at 96, and BP was 138/78. Her glucose was checked at 6:45 and was 167, but had come down to 155 at 7:30. Her skin's intact. Her lungs are clear to auscultation. However, she does have a productive cough, clear scant output. Her cap refill is less than 3 in her hands, but less than 4 in her feet. She is on tele. She's been sinus tachy. S1 and S2 are present. She does have some slight +1 non-pitting edema in her lower extremities. Her femoral pulses were +2 bilaterally, but her pedal pulses were only +1, so a little more weak and thready. Her abdomen was soft and non-tender. Her bowel sounds were normal active times 4. Her last BM was Sunday. She is on a renal diet with a 1,500 milliliter daily fluid restriction. Her output has been decreased, but she took in 375 mLs plus 75% of her breakfast, and we recorded 200 output in her Foley at 7:30. Her urine is amber and cloudy, and she was having some difficulty, which is why they put the Foley in. We did perineal care at 7:30, and she took care of her own oral care. She has gained about 10 pounds over the past few weeks, so we're doing daily weights and closely monitoring I&O. She has an 18 gauge right forearm saline lock, and that flushes well. We do need to collect a urine sample. There are supplies there at the bedside, and the patient was informed of the need for it and why. She has a left forearm graft, AV graft put in about 11 months ago, and there was an infection there about 3 months ago that resolved well with antibiotics. Both Abrui and Thrill are present. She does take clonidine twice daily. She had that at 7:29. She also has the acetaminophen every 4 hours PRN, and is now due for her antibiotic, and that'll be 500 milligrams of IV piggyback imipenem, which is every 8 hours, and it'll run concurrently on 30 milliliters an hour of normal saline. Our plan today with her is to do the urine and blood cultures, send her for dialysis today per her schedule, and then go ahead and start her on her IV antibiotics. Can you pause the video?
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication administration, then watch you demonstrate giving the medication in the patient's room?
No problem at all. What questions do you have?
Well, why specifically is the client receiving this medication, and what action does it have on the body?
The client's receiving this medication because imipenem is an antibiotic, and it's broad spectrum. So we don't have the cultures back yet. We're not quite sure what we're dealing with, but the provider probably has an inclination that it's some type of urinary tract infection, some infection of some sort at least, more than likely urinary with the dysfunction she was having. So this will help to take out more of the strong bacteria. What it does is it inhibits the cell wall and leads to destruction of the bacteria in the body. And so that's why we'd be starting her on this. And the cilastatin keeps the medication from being excreted by the kidneys too fast.
And when should you question administering this medication?
I would question administering the medication. Number one, if the client has any type of hypersensitivity to any of the carbapenems or penicillin or cephalosporins, because they all kind of originate from the same family. I would also question it. You should use caution when doing administration with somebody who has seizures. I would question it if they were taking medications that were contraindicated.
And does this medication have a therapeutic serum level?
It does not.
And which vital signs must be monitored?
Vital signs to monitor would be your heart rate, your blood pressure, and your temperature. Temperature would be key because the longer somebody's on it, their fever should start to come down. One of the adverse reactions you could have with this medicine is a superinfection, which would be an increase in fever.
And which physiological parameters should be monitored when the medication is being administered?
It's important to monitor the injection site for any redness or phlebitis while administering. It's also important to monitor any diaphoresis, any nausea, vomiting, anything that's sudden onset, or any signs of anaphylaxis.
What interventions must be taught to ensure the medication is administered safely in the hospital and then safely at home?
It's important both ways. Something like this, you're more apt to get in the hospital, especially with it being IV piggyback. However, it's important to know with any antibiotics, you want to finish your full course of treatment, even if you start to feel better. It's very important for them to report any and all medication allergies or adverse reactions. It's also very important that they provide an accurate and up-to-date medication list of things that they're currently taking, and that they also know to recognize signs and symptoms of anaphylaxis as well as any type of adverse reaction.
What are the side effects and potential adverse reactions?
Side effects for this medication could be hypotension. You could end up with nausea, vomiting, diarrhea. You could have phlebitis at the IV site or injection site if it's given IM. Adverse reactions would be anaphylaxis. And again, you could experience seizures with certain medications or certain conditions, or superinfection.
And how will you know the medication is effective?
You would see a decrease in the white blood cell count. You would see a decrease in signs and symptoms of an infection, so a reduced fever, maybe the appetite would increase, and just overall a better sense of feeling. Do you have any more questions before we go and administer the medication?
No, thank you so much for answering my questions.
Not a problem at all. It's important to know your patient and the medication you are administering to keep your patient safe. Good morning. How are you today?
I'm very well, thank you.
Great. My name's Caitlin. I'm going to be your nurse today. All right. And do you mind if I have a nursing student with me?
No, not at all.
All right. So the first thing we're going to do is we want to explain to them why we're here after we've confirmed who they are. So over here, I went ahead and I pulled up her medical record for her medications, and I'm just confirming that I think I am in Shanae O'Connor's room. So I have her record pulled up, and I'm going to go ahead and get it out of the way to say, can you please verify your name and date of birth for me?
My name is Shanae O'Connor, February 28th, 1980.
All right. So now that we've established we have the right person, we want to explain to them why we're here and remind just keep it in the back of your head that they always can say no to anything. All right, so Shanae, what we're in here for this morning is to start you on some antibiotics. Right now they're prophylactic until we get your cultures back, so we're going to start you on imipenem and cilastatin. Do you know what that's for?
I do not.
Okay, so it looks like there's probably some type of urinary tract infection or bacteria in there that the physician wants to go ahead and get a jump start on before the cultures come in. Now, do you have any allergies?
I'm allergic to sulfa drugs.
Okay, and is that the only allergy you have?
Yes, ma'am.
Okay, and what happens when you have that allergy?
I get a rash.
Okay. All right, and so sulfa drugs are not in this class of medication, so we're good there. And so what we're going to do next is we're going to just verify on the record what is due. Okay, so the imipenem and cilastatin is due at 8 a.m. and it's 7:39, so we're good on timing. And then that's going to run piggyback on a continuous 30 ml an hour of normal saline. So we've made sure we have the right client, we have the right medications, we have the right time. Now for route, again, imipenem and cilastatin is an injection, and this is specific to IV, the Premaxin. So IV piggyback is appropriate. And then for the normal saline, that could be a continuous IV fluid. That's appropriate as well. And 500 milligrams is standard dose for imipenem cilastatin according to clinical pharmacology. So now that we've established all that, what we're going to do is we've already got our supplies over here. I've pulled the medications, and I have the appropriate tubing. So the first thing we're going to do is just check the medications. We have the right medication. We have our sodium, we have our normal saline, and we have our imipenem cilastatin. And we're going to check the expiration dates, and on both of them, they both expired January of 2016. So we're all set there. And once we've established that, we're going to go ahead and just get our supplies open. Get those on. The first thing we can do is we have our primary tubing. Okay. And we can go ahead. Once we take these caps off, these parts are sterile, so as long as you don't touch them, it's fine. You just want to immediately spike the bag. Before you tip it, you just want to make sure your line is clamped. And because we know we are administering this via piggyback with the imipenem, I'm just gonna go ahead and get this hanger on here because it's gonna be the backup, so it's gonna want to hang lower. All right, we have it clamped. So just straighten out my line here. Going to hang this here, keep it clean while we get everything else ready. Now with the piggyback medication, you want to do the same thing. It's sterile once you've pulled it, and after you take the cap off your secondary line, you can just go ahead and stab in. And before we turn it, we also want to make sure the line is clamped. Alright, for the time being, I'm just going to hang this up here while we get everything else ready, but we'll need to prime the line momentarily. Okay, so we'll go ahead. This documentation system's a little different. You have to scan each individually, so we're going to start with the imipenem. And the first thing we need to do is, can I get you to verify your name and date of birth one more time for me?
Shanae O'Connor, February 28th, 1980.
Okay, so again, we've double checked, we have the right patient, we have the right medication that we're scanning in, and so I'm going to go ahead and scan the medication. Okay, so now that I'm verifying again, the computer has also told me that this medication matches this client with that ID number on their bracelet. I'm verifying The dosing is 500 milligrams as ordered. I have verified that on the back as well. It's in 100 mLs. It's IV piggyback. It's due at 8 a.m. So I'm just going to go ahead and put in the time right now, but I'm not going to submit it until I've actually done the administration, just in case something happens where I get pulled away. So before we hook this line up, I'm going to go ahead and prime the main line. Okay. So I just want to fill this chamber up about 1/2 to 2/3. And to prime the line, you can open the clamp here. Okay, and so I'm just priming the line here, and the important thing is to just make sure that all of the bubbles are working themselves out. And this is just done by gravity. And once I've primed the line, I'll go ahead and clamp it shut again. And then I've made quite a mess for myself. Then I want to take my secondary tubing and this is where I'm going to want to scrub the hub. We want it to be the last hub above the stretchable part of the tubing that's going to go in the pump. Okay. Okay, make sure this clamp is open. And I hold it below. You'll see it pushing and priming the line itself with saline. It's pushing the air back up in the chamber. You see the last air bubble has worked itself out. And now I see the level in the chamber climbing. So I'll go ahead and clamp that back off and hang it up. And now I'm going to go ahead and put my tubing into the pump. So you just keep the stretchy part in there. You can go ahead and shut the door. I'll take the cap off this. And again, another alcohol wipe. And we're just going to want to scrub for another 15 seconds or so. Okay. We'll turn the pump on. So this isn't a new patient. She's on continuous saline, so we're just hanging new bags and starting the antibiotic. And this is Med-Surg. We're going to select channel A. We're going to go to Guardrails IV Fluids and select 0.9% normal saline, and that is correct. So for our rate, we're going to want to do 30 mLs an hour per the physician's order, and the volume to be infused, we'll do 499. The bag is 500. This is just so it doesn't run out. Now we'll go to our secondary. And our secondary, we're going to go to F through J for imipenem, cilastatin, And this is the standard 500 milligrams and 100 mLs. And it's just double checking. So we're just verifying everything adds up. And we'll go next. The duration we want to give it over is 60 minutes. And then we can just go ahead, make sure our clamps are open on both. And we'll go ahead and hit start. And now the machine is going to check for any air in the line. And while this is checking, we just want to verify with the patient that they're feeling okay, that they're not having any problems. So Shanae, how are you feeling?
I'm feeling okay. Much better than last night.
I'm glad to hear that. So what we're going to do with this is I want you to use your call light to let us know if you're having any type of problem at all, no matter how you're feeling. But some side effects could include feeling lightheaded or dizzy, if you're starting to feel flush or hot, or if you feel nauseous or that you need to use the bathroom. So what I'm going to do is I'm going to come back in half an hour just to see how you're doing again. And I also have printed off some signs and symptoms of superinfection as well as side effects of this medication and when to notify your provider. So if you want to go ahead and read that over, and when I come back in about a half hour, we can discuss it again, okay?
All right, thank you very much.
All right, so I'm just going to finish up some documentation. So down here in the comments box, it was given in the right forearm IV. It was administered with normal saline, 0.9%. The patient tolerated the administration well. Advised of signs and symptoms of adverse reaction. And put my initials. Okay, and again, because of the documentation system, this would all be done at one time. I'm going to go ahead and verify one more time, even though we did do it before we gave the medication. What's your name and date of birth?
Shanae O'Connor, February 28th, 1980.
Great, thank you. And then we're going to want to scan in the normal saline, even though we did verify everything. And it turned green, so it is matching our checks as well. We did give this in the right forearm IV. So right forearm IV administered at same time as imipenem, 500 milligrams and 100 mLs over 60 minutes. Hung 500 milliliter bag to be infused 30 mLs an hour. I'll initial that. And we're all done.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions for you if you don't mind.
Sure.
Well, were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I definitely reviewed the patient's record. So their allergies, what the reactions were to those allergies, what medications they were taking, did any of it interact, what their medical diagnoses were, how those were being treated. Also just reviewing the medication order itself. Was it for the right dose? Was it for the right route? Was there any contraindications or any interactions that I had to be worried about?
Did this information affect your decision to administer the medication?
It did. Had any of those things been out of line, the route being incorrectly put in, the dosing being incorrectly put in, a contraindicated medicine or condition, any type of allergic response, anything that didn't coincide with it being a correct dosing and administration, I would have withheld the order until I got clarification from the physician.
Did this information affect how you administered the medication?
Well, this medication is typically an IV antibiotic. I would have questioned had the physician had on the order something other than IV piggyback. But I always do double check. You want to make sure you're looking at the order and does it coincide with what the physician entered.
Thank you so much for answering all of my questions. I really feel like I understand this so much better.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take some time now and document the teaching I provided to the patient and any other things I did in the patient's room. Do you want to observe me documenting as well?
Sure, I would love to watch. Thank you.
Okay, so now that we've administered the medication, it's important that you document everything you do in the patient's room, as well as it's important to document how they're reacting, different changes in the treatment, what you've noticed, what you've assessed. So, the teaching was on their diagnosis. Let's see. So suspected UTI. Now I'm going to go to treatment and select pharmacologic and medications for antibiotics because we gave them information on their antibiotics that we're administering. So a printed handout was given. I don't want to document a verbal explanation and discussion because we explained to her that we'd come back in a half hour, do an assessment, and discuss it further than after she had a chance to read. So we want to document our plan by stating what we've done and what we want to do. So we'll return in 30 minutes after administration to review handout and discuss as well as assess for adverse reaction. So it's very important that you have a plan and you're documenting appropriately in the system what you're assessing, what you're watching for, and what you've done.